Well, welcome back. You know, we often talk about the importance of listening to our bodies, and if you're experiencing pain that doesn't go away or something just doesn't feel right, your body is trying to tell you something, and that goes for our kids too. Maddie and her mom Jen, along with vascular surgeon Dr. Stuart Harlin from UT Physicians, are all here on the couch now to talk about a condition that commonly affects athletes of all ages. Thanks so much for being here, and welcome to the show.
Thank you for having us.
Maddie, let me first start with you, and Jen, if you can kind of talk about your story. You've been an athlete, a swimmer since age 6, yes. So you've been an athlete basically your whole life. You know what that's like to put your body through that and the training. But what was happening? You were suffering from some pain, right?
Yes. A couple practices in a row, my arm would like swell up after practice, and it was really tense, and just a lot of like stiffness in my arm where I couldn't really move it all the way. And then I talked to my coach, and she sent me to the trainer, and then at the trainer, I just had taken a picture, and the trainer told me, like, oh yeah, we need to get this checked out. And then I got it checked out, and turns out it was a blood clot.
It's really incredible. And when this is the photo, and we can see the difference in the arm there. And Mom, when you first heard about this, the pain as a mom
yes.
of an athlete, what initially were you kind of like, oh, it's going to be fine?
Yes, of course. You know, they work hard all the time, and you're like, it's fine, you know, rest it, ice it. We did take her to a chiropractor along the way. But when that picture was actually what really kicked off understanding that it was something more serious.
And I agree. I mean, Dr. Harlan, when we look at this photo and we think about our kids and the training that they're in all the time, when we see something like this, how common is this condition that Maddie has?
It's really not very common at all. I do vascular surgery, so we see it all the time, but part of the population is not very common at all. But when you see a giant asymmetry like that, where one's just enormously bigger than the other, it's clearly an indication something's going on.
And what was going on with Maddie?
Well, Maddie had a blood clot in her arm from a congenital narrowing between her collarbone and her first rib, where the vein was being pinched, and all the exercise she did had just overstimulated at the point where the blood wouldn't get through.
So maybe after years and years, like it sort of started as pain, but then the swelling kind of came later?
Yes, ma'am.
Okay.
Exactly. Well, the vein became so pinched off that the blood couldn't get back to her heart, and then because it was just kind of static like that, that formed the clot.
It's really fascinating. So the swelling, the discoloration, those are obviously warning signs. What was the best way to fix it, to make it better?
Well, we need to get rid of the clot first, and so there are a variety of ways to get rid of the clot. In a very young, healthy woman, we really don't want to leave that clot in place forever because it can cause a lot of damage. So we chose to dissolve the clot with some medicine designed to do that. And then once the clot was gone, we needed to fix the problem that caused it to start with.
And Mom, I can imagine, Jen, when you hear, or Maddie, oh, you have a blood clot in your, I mean, you probably didn't hear anything after, anything that he said after that, right?
Absolutely. Yeah.
And how scary was the process?
It was so shocking because Maddie doesn't have any of the, you know, she has no likelihood of getting something like that. So it was very surprising, but we were in the hospital. Dr. Harlan worked on her for 3 days, and they took great care of her. So.
It's really incredible. And this actually has a name, so let's see if I can say it. Thoracic outlet syndrome, TOS, basically?
Yes, ma'am.
And sometimes this can get misdiagnosed?
All the time, especially a lot of people will not have vascular problems. They'll have neurogenic problems where they'll have pain in their arm or their hand, their chest wall, because the nerve's being compressed more than the artery or vein. And so that can present as a whole bunch of other things, carpal tunnel, other, you know, shoulder ailments, stuff like that. And
Maddie obviously is an athlete, and so other athletes, if they're seeing, you know, other kind of swelling, is that typically happening in the arm and shoulder for this?
Yes, ma'am. Usually in the dominant arm, especially we think of baseball players, tennis players, volleyball players, overhand athletes, we'll see it in their dominant arm.
And consultation, I mean, how would this, if somebody's at home saying, oh my gosh, I think this is what I have or my child has, what's the best way to get this diagnosed? We like to get, you know, seen by your primary care doctor or her trainer or whoever's teaching that. And this usual simple stuff for diagnosis, ultrasound, usually is all you need. Okay. And how you feeling today, Maddie?
I'm feeling great. Yeah, I'm doing physical therapy, getting back, hoping to get back in the water soon.
Yeah, oh, that's good. That's really good. And I can imagine too, you know, just that process and knowing that you're in such good hands and being diagnosed with something sounds really scary, but to be in such great hands in our backyard, I think is so comforting.
It definitely is.
How was the recovery process?
It's been a little bit long, but it's been good. It's been coming back up.
Yeah, climbing that hill. And Mom, for you, what was that whole process now to see Maddie on recovery?
Yeah, I'm so proud of her, and I'm proud of her for, listening to her body and speaking up, getting it taken care of. And she's just had like such a big year of doing her therapy, being patient, not being in her sport. That's really hard, but she's shown a lot of character. I'm really proud of her.
And it was a year before when you kind of knew, like, you had some pain, and so you had mentioned that you went to a chiropractor to kind of relieve that pain.
Yeah.
And a year later is when that diagnosis happened.
Yeah. So it is, it is very rare, and it is, it masks as a lot of other things. So, you can't beat yourself up for not knowing, because it's such a rare thing. But again, I feel like the right people sounded the alarm. Like, that picture helped a lot. So I'm proud of Maddie for taking a picture, and don't know if I would have thought to do that. And the right people to pass her on to Dr. Harlin. So I feel grateful. And you mentioned, we're in the best city for the best care.
I mean, it's so true. And honestly, I think as parents too, listen to our kids, take those pictures, and definitely have somebody, a doctor, to really look at those photos and see the evidence of what you're dealing with. Because sometimes I think when you're feeling pain, you kind of think, oh, maybe it'll go away. And then all of a sudden, a year later, you're in that situation. So, y'all, thanks so much for coming in. Really great information and sharing your story and on the road to recovery. We do appreciate it. Maddie, Jen, and Dr. Stuart Harlin, with vascular surgeon with the UT Physicians. By the way, for more information to connect with Dr. Harlin, all you need to do is log on to utphysicians.com, or you can simply call 888-488-3627. Thanks again.
Thanks for
appreciate it.